Growing fears of a swine flu pandemic. Today, the U.S. government took the extraordinary step of declaring it a public health emergency. There are 20 confirmed cases of the disease in this country, 8 of them at a high school in Queens. In Mexico, the swine flu virus is blamed for at least 86 deaths, with another 1,400 people infected. CBS 2 has team coverage from Mexico City to the tri-state area. We begin with Dave Carlin live in New Hyde Park. Dave.
Mary, right behind me, Schneider's Children's Hospital dealing with a wave of students from St. Francis Prep, which is nearby, a campus in crisis. 8 confirmed swine flu cases, all students at St. Francis Prep, which will remain closed Monday. This message from the principal is on the school's website saying, don't bother showing up. One of the confirmed 8 students with swine flu is 14-year-old Frederick Jolin.
I think it's really scary.
Why?
Because it's at a point like anybody could get it.
In his case, and all the others in New York, symptoms are mild enough that no one is hospitalized. But Dr. Bruce Farber of Schneider's Children's Hospital says that has not stopped scores of worried parents from bringing their kids to the ER. How many people have you seen?
Between 100 and 130 patients have been seen since Friday night who have been concerned about being exposed or having swine influenza.
And what do they have in common? What are the symptoms and the degree of the illness?
Most of the patients have had low-grade fevers, cough, sore throat, a little bit of malaise, muscle aches. None of them have been horribly ill.
City hospitals and schools are ordered to be on the lookout for possible cases as investigators gather the recent travel histories of the St. Francis students.
We do know that some of the students from the school had a spring break in Mexico, but until we actually sit down and do the real science of recording who came down with it and who went, we won't be able to give you a definitive answer. But I don't think it makes any difference if one person brought it back from Mexico and they didn't come down with symptoms but infected others. The bottom line is there is an outbreak at St. Francis School.
Back live at the hospital, Dr. Farber says there are plenty of doses of Tamiflu here for patients who might need it. I asked him another question about cases in Mexico and one in Texas where the family or families are being quarantined. Why isn't that necessary here? Dr. Farber said it is because the cases here so far have been mild and the patients have been recovering at home. So they think a quarantine situation is not necessary, at least not at this point. Live in New Hyde Park, Dave Carlin, CBS 2 News.